Hello guys, welcome back, and I hope you all are doing absolutely fine. So today we'll be starting a new series of gynecology important definitions plus pointers and previous year's 2 markers covered for you all. So this video will in a way help you to revise all the important definitions, 2 markers and important points for which you need to remember for gynecology's paper, which is paper 1, and I hope this video helps you all out. And also we'll be targeting 1000 views on this video and 100 likes. So whenever it is done, I'll be releasing the notes on my Telegram channel and will be providing the link in the description as well for the same. So without much ado, let us begin. So this video series will be continuing in parts of approximately 10 minutes each. So it becomes easier for me to upload the videos as well. So let us begin. Progesterone. It is a female hormone produced by corpus luteum of ovaries and by placenta. It helps to prepare endometrium for implantation. Low level of progesterone occurs in ectopic pregnancy and abortion. High level of progesterone occurs in hydatidiform mole. Ovulation. It is a process in which rupture of Graafian follicle and release of secondary oocyte from the ovary takes place. Then it is available for fertilization. Ovulation occurs on the 14th day of the menstrual cycle. It is under the influence of luteinizing hormone, which is LH. The ovum enters the fallopian tube. Thalarch. It is the onset of breast development. It is appearance of breastbud. Menarche. It is the onset of the first menstruation in female. It occurs between 10 to 16 years. Pubarch. It is the appearance of pubic hair at puberty. It results from rising levels of estrogen in female and rising level of androgen in male. Precautious puberty. It is the onset of secondary sexual characteristics before the age of 8 years or menstruation before the age of 10 years. Isosexual precocious puberty due to excess production of estrogen may happen. Heterosexual precocious puberty due to excess production of androgen. Menorrhagia. It is cyclic bleeding at normal intervals. The bleeding is excessive in amount above 80 ml or in duration that is more than 8 days or both together. Causes of menorrhagia: fibroid uterus, dysfunctional uterine bleeding, DUB, adenomyosis, polyps, pelvic inflammatory disease. Metorrhagia. It is an irregular acyclic bleeding from the uterus. Amount of bleeding is variable. Polymenorrhea. Menstruation occurring with intervals of less than 21 days. Causes of polymenorrhea: fibroid uterus, dysfunctional uterine bleeding, pelvic inflammatory disease PID, and ovarian cyst. Oligomenorrhea. Menstruation occurring with intervals of more than 35 days. Causes of oligomenorrhea are obesity, menopause, PCOS, and hyperthyroidism. Cryptominoria. This is also separately asked for 5 markers and it is a very important question. Cryptominoria. It is a condition in which menstruation occurs but the menstrual blood fails to come out from the genital tract due to obstruction in the passage. Causes of cryptominoria are congenital, which is imperforate hymen, and acquired, which is cervical stenosis or the narrowing of the passage. Natural methods of family planning. Safe period rhythm method. A week before and a week after menstrual bleeding is considered as the safe period for sexual intercourse. Coitus interruptus. Withdrawal of penis right before ejaculation. Lactational amenorrhea method. Advantages of condom: no side effects, cheaper and easily available, easy to carry, simple to use, protection against sexually transmitted disease. Disadvantages of condom: may accidentally break or slip off during coitus, inadequate sexual pleasure. To discard, it is supposed to be discarded after one coital act and the failure rate is nearly 14%. Polyzoo Spermia. It is an abnormal condition in which the sperm count is more than 350 million per ml. It is a cause of male infertility. Oligospermia or Oligospermia. It is an abnormal condition in which the sperm count is less than 20 million per ml. It is a cause of male infertility. Teratozoospermia. Abnormal morphology is seen. So it is an abnormal condition in which less than 70% of the sperms with abnormal morphologies of sperm is seen. It is a cause of male infertility. Necrozoospermia. It is an abnormal condition in which spermatozoa are dead or motionless. It is the cause of male infertility. Asthenozoospermia. It is an abnormal condition in which reduced sperm motility is observed. It is the cause of male infertility. Aspermia. It is an abnormal condition in which failure of emission of semen takes place. It is a cause of male infertility. So also note that spermatozoon is a singular and spermatozoa is plural. Azoospermia. It is an abnormal condition in which there is no spermatozoa in the semen. It is the cause of male infertility. Spermatogenesis. It is the process of formation of spermatozoa from the primordial male germ cell. It occurs in seminiferous tubules of testes. This process takes place in 61 days. Fertilization. It is a process of fusion of the spermatozoon with mature ovum. It occurs in the ampullary part of the fallopian tube. Primary infertility. Those patients who have never conceived a child even after a year of regular unprotected coitus. This condition is termed as primary infertility. And secondary infertility. Those patients who have a record of previous pregnancy but there is a failure to conceive a child again. This is known as secondary infertility. So guys, this was the part 1 of the gynecology important definitions, pointers and 2 markers revision series. I hope this video helps you out to revise the important points of Gynaec paper 1, and I hope you all remember it till your exams and even after that as well. So this video was a good revision pointer for you all, and if you do like it, please do give it a thumbs up. Subscribe to our channel. It will motivate us to make more and more such videos for you all, and please do support us. And lastly, please do share it with your friends and help them as well, because I am sure it will help you all out. So I'll see you in the next video of this series. Until then, goodbye and take care. Thank you.